जय माँ शारदा, भगवान सबका भला करे. If you like my video, please like, share and subscribe. So let's start. Today we will discuss about preparation of clients unit part 2. In the part 1 we have discussed about optimum environment for the client, then influence of external environment, and today we will discuss about factors of safety. So let's start. Freedom from mechanical injury. Mechanical injury may be caused by machines by falls and blows. Mechanical injury can be prevented by using rails or guards on beds and windows, by keeping floors dry to prevent slipping, by holding the stretchers and wheelchairs securely while transferring the clients, etc. A periodic checkup of the equipment can prevent accident from them. The next one is freedom from thermal injury. Thermal injury is caused by fires and burns. The triple hazards of fire are burns, trauma and asphyxia. Burns may occur from the application of heat. Some possible causes of fire in the hospital are smoking in bed, defective wiring, then explosion of gases and use of the heaters and hot plates. Fires are prevented by reporting and repairing defective electrical equipments, safeguarding inflammable liquids and gases, and having fire extinguishers recharged from time to time. Then next, freedom from chemical injury. Chemical injury involves the use of too strong chemicals and poisonous chemicals kept within the reach of the client. Chemical injury can be prevented by keeping the chemicals in separate cupboards under lock and key by using them with care. Then freedom from radiation. Radiation injury occurs from overexposure to the rays of X-ray, radium, infrared and ultraviolet light rays. These injuries can be prevented by having trained operators and having enough protection from exposure to these rays. Then freedom from allergens. Injury from allergens may result from insect bites or from materials in the environment such as feathers, mattresses, food, cosmetics, lotions, powders, medicines, etc. Prevention of allergy may be accomplished by having covers for the mattress and pillows, adopting dusting without raising the dust, and by testing for allergens before an agent is applied on the body. Then freedom from vermin, insects and animal pests. All buildings should be rat proof. If rats are present, they should be trapped or poisoned. Flies will find a breeding place where the dirt is accumulated. Therefore, the hospital should be clean to prevent breeding of flies. Prevent the breeding of mosquitoes by removing the stagnant water and by using mosquito repellents such as DDT spray, etc. Moths, bedbugs and cockroaches are kept away from the client's unit by the use of DDT spray, fumigation of the room, and by the use of naphthalene balls in the cupboards. Next, furnishing for the client's unit. Client's unit is the area furnished and equipped according to the necessity for the care of the client. Most of the equipment and supplies needed for the client care are kept in the client's unit. They include, first one is cot or bedstead. The standard hospital beds available are made of metal. It is simple in design, light and easily movable, easy to handle and clean, and it is also strong and durable. Hard rubber casters make it possible to move the bed without jarring the client. Some beds may have devices to adjust the position of the client at the head, knees, and foot end. A standard hospital bed is 78-inch long, 38-inch wide, and 28-inch high from the floor. The height of the bed is such that physicians and nurses may have convenient access to the client without fatigue. Some beds will have side rails to prevent the client from falling. Overweight table. The client can use the overweight table or cardiac table for such activities like eating, reading, writing, and for placing articles for self-care. It is also useful for the nurse to place articles while giving care to the client. Generally, it is used for the client who is suffering from cardiac disease to lean and rest forward when he has breathing difficulty. The next one is bedside locker. The bedside locker is used to store the client's person. A client's unit is most comfortable for him if he has within his reach those items he frequently uses. Such articles can be kept on and inside the bedside locker. Then bedside table. The clients who are allowed to move around can use bedside table for taking the meals and for other purposes. Then chair and stool. Most clients' unit have at least one straight back chair with or without arms and a stool. The workers and the visitors should sit on the chair and not on the client's bed. Then bedside commode. Bedside commode is a chair or wheelchair that has an opening in the center of the seat under which a bedpan can be inserted. The bedside commode is preferred to bedpan because the client can be seated in the sitting position during defecation and urination, a position most comfortable for the client. Then bedpans and urinals. For a client confined to bed, bedpans and urinals are used for defecation and urination. Then sputum cup. Sputum cups are usually used to collect the sputum and sittings. Then kidney trays. Kidney trays are usually used for collecting the vomits, soil dressings, or for collection of body fluids, etc. Means it is mainly used to collect the wet waste. Then water flasks and drinking glasses. The water flask is filled with drinking water and is given to the client within his reach. Then plate, spoon, fork, knives, etc. These are used to serve the meals for the client and is kept in the client's unit. Then call signal. A bell is usually kept near the clients to call the nurse in their need. Toilet articles, soap and soap dish, toothbrush and toothpaste, mouthwash, comb, etc. are kept in the client's unit, may be brought by the clients or may be supplied from the hospital on payment. Soap and soap dish, toothbrush and toothpaste, mouthwash, comb, etc. are kept in the client's unit, which may be brought by the clients or his family members. Then waste basket. It is used to collect the rubbish. Then bucket, mug, basin, etc. that are kept in the bathing room for taking bath.